If you've ever struggled with back pain, you know how frustrating it can be. What if I told you that actually strengthening your back muscles was the key to preventing back pain before it even starts? Well, today I'm going to talk you through some simple exercises that are going to build strength, improve your posture, and help stop your back pain. My name is Dr. Dawn Andalone. I'm a women's health physical therapist and back pain specialist, and you may not realize how important strong muscles around your back may be. But back pain is often caused by not having enough support around the part of the spine that starts to get breakdown, whether you have a disc injury, those discs in between your vertebrae, or a joint injury, a muscle strain. If your muscles are doing what they should, you should be able to get over back pain a lot faster and also prevent further breakdown and arthritic changes down the road. Your back is the foundation for movement, for posture, and for stability. So poor posture over time leads to a lot of tension in your muscles. And then weak muscles create a lot of added stress on the spine. Everyday activities such as lifting, bending, twisting, it gets a lot harder when you don't have that muscle support around your back. So what do we need to do? We need to work on specific exercises that are going to help build that foundation and help the strength and stability around your spine. So before strengthening, we're going to do a little warm up with a couple of my favorite exercises. I love to teach Pilates-based exercises because that is the background and the foundation of how to protect your spine is using Pilates, which I have used for years and years to help a lot of the clients that I've seen get over back pain. So the first one is called a cat-cow, very basic spinal mobility exercise just to get things moving. So you're going to be on your hands and knees. Hands are under your shoulders, knees under your hips. And you're just gonna gently curl your spine toward the ceiling and then drop your navel toward the floor, going back and forth about 10 times without holding your breath. You want to use your breath to help the movement of your spine. Now, if any of that is painful to do, just go within the motion and within the mobility that is comfortable for you. If you have trouble being down on your knees, you might want to try it in your kitchen countertop, and you can just bend forward while you're standing and then round and move your pelvis back and forth, or move your spine in a little curve like an angry cat, and then drop your navel the same way. Then the next one is a extension stretch. So I'm on my stomach. You can do this on your bed too. And you're just gently lifting your chest, pushing your forearms into the floor, and then back down. So I'm just moving my spine backwards, and I'm gonna repeat that about 5 to 10 times, just nice and gentle. If you do have spinal stenosis and you know you have spinal stenosis, probably not a great one to do, so don't do that, but go back to the cat-cow and use that as your gentle warm-up. We're going to start with some basic strengthening exercises, and the goal of these strengthening exercises is really to connect that whole core area. Those muscles work, your inner abdominals to your back muscles all work like a corset to protect your spine. So when that muscle group is working properly, you're going to be able to bend, twist, and move a lot easier, so the foundation can take the load rather than the joints of your spine. So the first one is a bird dog exercise. Once again, I am on my knees. I'm going to gently pull my navel in toward my spine, keeping my back nice and flat. And then I'm going to extend the opposite arm and leg, nice and slow, while trying to keep my back flat like a tabletop. A little trick, I like to use a pillow on my back because that's a reminder and gives you feedback that you're not twisting and moving your back. So you're keeping your back nice and stable, trying not to let that pillow fall off your back. And you can do about 5 to 10 reps on each side. The next exercise is a bridge, and you're gonna be on your back.
This one might be a little more comfortable for those people that might have difficulty kneeling. So we are engaging through those abdominals, and then you're going to gently lift your hips, keeping your hips nice and level, and you'll feel a little tension across your lower back. Keep your abdominals engaged, squeeze your glutes, and lower back down. You want to exhale as you lift, and then inhale as you lower. You can do about 5 to 10 of these, and then stop and take a break. And feel free to repeat 2 to 3 rounds of that bridge exercise. That's going to work on the muscles in your lower back and your hips and even your hamstrings too.
The next exercise is on your stomach. So you can do this again on your bed if you are more comfortable rather than getting down on the floor. But we're gonna do a Pilates mat exercise that I love, but it's also a little bit challenging. It's called swimming. So we're having our arms up in a V next to your ears, and you're gonna lift your legs slightly off the floor, but keep your abdominals engaged so you don't use your back too much. You wanna use really that whole corset around your spine. So I'm pulling in through my navel, and I'm gonna flutter my arms and legs. You're going to count to 10 and make sure you keep breathing. And you're using all those stability muscles around your back, lower back. And then rest after 10 seconds. Now, if that's too intense or causing some pain, go back to the ones that are more comfortable. And then also you can just do your arms, or you can just lift your legs and start from there until you build up enough endurance that you can do them both at the same time for at least 10 seconds. Now, I love to add in a little weightlifting, and a lot of people are intimidated by deadlifts because they feel like they're actually bad for your back, but that is a myth. They actually, if you're doing them correctly, they are actually one of the best exercises you can do for your spine, spinal muscles, and your glutes and your hips, which actually protect your back. So a deadlift is different than a squat. And if you've seen me demonstrate this in other videos, you don't want to bend your knees. We just keep a tiny little bend in the knees, but we're flexing from our hip joint. So it's like you're creasing at the hip. When you lift up, you're coming up nice and tall, stacking the ribs over the pelvis. I'm going to lift a small weight. I have about 20 pounds here in a kettlebell. You can use a dumbbell, or you can do it without any weight to start. So I'm flexing at my hips, sticking my butt back. My back is nice and flat. I'm not rounding my back at all. You really want to stick your tailbone back as far as you can. Then you'll pick up the weight, squeezing your glutes, tightening in through the core, and lower it back down slowly. Lift, squeeze the glutes, and lower back down slowly. Use your exhale on the way up. This is more helpful for your pelvic floor and your back. Your core muscles will engage and work better if you exhale on the way up. So with those deadlifts, you can do about a set of 8, repeat 2 to 3 rounds of that. And over time, you can be able to lift a little bit more as long as you're comfortable and doing it correctly. Have someone watch your form or do it in a mirror so you can make sure you're not rounding your back. And you shouldn't have pain the next day. You should just feel like you've used the muscles, and the muscles might be a little bit sore, but don't confuse that with actual back pain. It's probably that you're just retraining your muscles, and they will be a little bit sore through your hips and your lower back the next day. So common mistakes when it comes to back pain, just relying on stretching is not the key. You need to build strength, and you need to work on some resistive type of exercises. Body weight is okay, but adding in like using a Pilates reformer in a studio, or adding in some weight training and learning the correct exercises on how to hold your posture and how to use your hips as well as your core is really going to build a stronger foundation to help prevent long-term back pain. So another common mistake is avoiding using your hips and core. Those actually need to work together and are key to helping support your back. And we find that so many people that we see with back pain, they do not have strong hips. They might have tight hips, but they also don't have a lot of strength in their glute muscles or their hamstrings. The whole backside of their body has gotten really weak. And so usually working on that and building a foundation from there will help so many cases of back pain. And then the last mistake is lifting with bad form. Once again, make sure with any of these exercises that you're doing them properly, how I've instructed, or else you're working with a professional that can really fine-tune things and give you feedback on how to do them correctly, and especially for your type of back pain. Now, in this video, if you're doing any of these exercises and they're causing pain, definitely stop. You want to check in with a professional. A physical therapist is going to be able to guide you in the right direction. I also have an amazing program, Pelvic Floor Pilates, that can really help build a strong foundation through your core, through your hips, and your pelvic floor muscles, which help support the bottom of your pelvis. So doing Pilates-based exercises are a couple of these that I showed in this video, but I have so much more as part of this daily program that you can purchase. I put a link right below that'll describe more about the Pelvic Floor Pilates program. So with back pain, I hope you find healing and you find a plan that works for you. It's really just 15 minutes a day of dedicating to some customized exercises that are really going to push you in the right direction and help manage your symptoms for the long term, so you actually cannot be debilitated by back pain. You shouldn't have to sit out from activities. You should be able to be active, be mobile, and doing these kind of preventative things are really going to help you for the long run. If you want more information, please subscribe to this channel. I release new videos all the time and would love to help talk you through some other exercises to help with your back pain or any other women's health related issue you're having. Thanks so much for watching. We'll see you again.